We were commissioned, as we have been in previous years, to run a community research project. We went for more of a collaborative workshop approach where we'd get clinicians to come in to communities and talk to them.
Cancers are taboo. Talking about it, they don't say cancer. They say the evil disease. They don't even like to mention it.
Men were having certain phobias about the anal check, and certain, like, they're not having anybody interfere with their rectum and stuff like that.
I think the main thing that I was there to do is not only to educate, but also to try and break down some myths, to try and take away some of that anxiety and fear, to try and make it more accessible, more approachable, to be a friendly face in the community.
When you have a workshop and you have people who are very knowledgeable in their fields, when they're talking, you know, it's just silent. And people are really absorbing what they're saying.
The intimacy of it was what I thought was the best result. The more you go into it, there are things you learn that, oh right, blood test, PSA, biopsy, all things which you think, oh, I wasn't aware of that.
I came to the community workshop. I didn't think I had a prostate issue. When the doctor mentioned the symptoms, the signs, I asked a question. I told him I was going to the toilet 4 or 5 times a night. He explained everything carefully and encouraged me to go to my GP. I was very worried. I immediately made an appointment and a biopsy test was made for me. When results came back, they told me I had prostate cancer. He said I was very lucky I came. The surgery was done by a robot. They went in through my stomach. The prostate was removed. The operation went well. Praise be to God.
So we've had some really good feedback from NHS colleagues who were involved in the delivery of these sessions. They say that they've really personally benefited from being in the room, from hearing firsthand from patients.
We needed to improve access to primary care. So what we've asked our GPs to do within North Central London is to offer men at high risk of prostate cancer an opportunistic PSA test whenever they attend their GP surgery. One of the projects that has started at one of our hospitals at University College Hospital is something called our Buddy Project, where we have a non-medical black man who acts as a friend, as a point of reference for men who are diagnosed with prostate cancer or coming through the diagnostic pathway, who are uncertain about what the future might hold.
Since the workshop, we talk about these issues more in our social circles. I would tell them to speak to their GP, ask about a PSA blood test, and follow through on the advice.
My life is getting better. I'm not worrying and I feel well and more positive. Only God knows, but without attending the workshop that day, I would have been in a serious situation.